'Cause we don't plan what we talk about, so just be aware.
We will be appropriate, though. We promise.
Ish.
It's too early for pop quizzes.
I'm like, Stephanie, come on. Ish.
Okay. I think, there's the preview. I see Stephanie bouncing. We're going live anyway. And here we go. We are now streaming live on Facebook. Look at that. For those of you that waited 3 minutes, this is going to be worth the wait.
Yes.
It is 8:33.
Thank you for your patience.
That's right. And we are here on what? What are we here on, Stephanie?
We're on Rumble in the Dream.
Rumble in the Dream.
Yeah.
I'm the Dream, duh, and you are?
Rumble.
She really hates it when I do that. It's like,
I do.
No,
I don't like
it. That's not it. I'm not Rumble. Well, I am the Dream, so you just take note of that. So this is our second to last Rumble and the Dream, and we get to talk about next Friday what that looks like. This Friday, right now, in this moment, we have like 5 freaking powerful ladies on the screen. So we usually introduce ourselves, right? And we are not scripted, but I am going to ask you to introduce yourself in an unusual way. How does that sound? Christina's like, oh no, here we go. I want you to say who you are and what you do, but I want you to share with our audience, like, the coolest thing about you.
And I get to go
I
first.
think, Christina, you're first. Yeah.
The coolest thing about me?
Yeah, but who are you first?
Oh yeah, I can start that. Christina Bender. I'm a dentist here in town. We own Pearl Care Dental. Coolest thing about me. Can I come back to that one? No, I can answer it.
Let me get the Jeopardy going, dude.
I know, right? I think coolest thing about me right now, my family. That's my home. That's my stuff.
So that means you're the coolest mom because you
I'm a
created
mom
that
first.
family.
I'm a mom first. I was a dentist first, and then that changed, and then I became a mom. And now
Thank you, COVID-19, right?
Yeah. Thank you, COVID.
All right, who's next?
I can go next.
There you go.
we can rock, paper, scissors. Who gets to go next?
Oh,
You go, girl.
Okay. My name is Iris Ulep. I am a dentist at Pearl Care as well. I get to work with Tina and Carrie. Coolest thing about me, I might have peaked in high school. I won a pole vaulting championship. So that's probably the coolest thing. Really fun fact.
That's cool.
Do you do that around the office at all? Like pole vault into a room?
I think she needs to now.
I mean, it might shake things up a little.
The presentation's a little bit. Yeah, that's a great idea. I think I have to incorporate that.
Okay, good.
Or like pogo stick around the office or something.
Oh, snap.
That's true. I have to try that out.
All right.
All right, Carrie.
All right. I'm Dr Chellis, and I'm a dentist. I've been so lucky to have joined with Dr. Bender and Dr. Iref, and I'm starting a new portion of my career after being 40 years in dentistry. But this is the best. The best is yet to come. So here we go.
I love it.
So you guys are
You
new.
want to go too, Stephanie?
What's that?
You want to go as well?
Sure. I'm Stephanie. The coolest thing about me is, sorry, I'm shaking my computer. I think the coolest thing about me is my relationship with my husband.
Yeah. I don't know much about that, so I'm excited to learn more.
Yeah, well, we're not going to learn it today.
Okay. Great.
That's for another Time.
A whole nother segment. Okay, we'll
Yeah.
talk about that later. All right. What are we going to talk about today, Stephanie?
Well, I think we need to talk about these ladies and what they have been doing during their downtime to up their game.
I
What have you
just
guys
got
been
to
doing?
say, I keep looking at this screen and it's like girl power, girl power. I love that. And I love that all 3 dentists at Pearl Care are women.
Yes.
Yes.
It's amazing.
Yes, power to the women.
Yes.
We love you too, Matt. We love you too, Matt. Okay.
Yes.
All
Alone.
right, we'll take it away. What have you guys been up to? And of course, let me just say, anytime you want to know who the best dentist in town, I'm going to tell you it's this one because they are my dentist. And honestly, when I came back to reality of not seeing the dentist in 10 plus years, I never once felt shamed or unsafe or anything. And look at these teeth. Look at these teeth.
They're awesome.
Yeah.
Oh, thank you. Thank you. We've been busy during COVID-19. We've been really, really busy. So we participated for 3 weeks in online learning, and we are going to be starting to incorporate really a whole new way of thinking and keeping patients healthy. It is an appliance, and I'll let Dr. Carey elaborate a little bit more on that. But I think it is really going back to the oral systemic connection, the health of the whole body, and that we are so much more than just a dentist that looks at your teeth. There's so much more that goes on. And that's always been at the heart of Pearl Care. And so this just adds that one more layer. So we spent 3 weeks in really diving into this just new knowledge, and we're kind of excited to start learning and applying it to the office. So I'll let Dr. Carey elaborate on it a little bit more.
Well, because
Well, you mentioned
I was just going to say, because this is what I do. I butt in a lot, but it's really a loving interruption. And I just want to say that what you talked about, treating the whole body, is really what you feel. Like that's the feng shui, really. Like the feeling when you come into a well feng shuied room, a well feng shuied office, is the feeling, the energy. And because you look at the whole person, that's what you feel when you come into your office. So I love that. Okay, Carrie, I'm going to zip.
That was perfect. That's perfect. I should have just had you said that.
No, you were good.
It's all good. So, yeah, we've been doing postgraduate training in airway and breathing and how to manage sleep apnea in a permanent solution for the mild to moderate sleep apnea patients. And it's done with a removable appliance that permanently changes the airway and may reduce the need for CPAP and all the other appliances that people have tried to use. Non-surgical, non-drug, a removable appliance that you wear 14 to 16 hours a day for 12 to 24 months. Most people average 18 months. And then your mild to moderate sleep apnea may be completely cured permanently.
Sign me
It's
up.
pretty cool.
Yeah, that's amazing.
I know.
Seriously.
Everyone.
I gotta ask, is this training that you were gonna do anyway, or did this break in your business?
I started my training years ago with Dr. Dave Singh, who invented the appliance and patented the appliance and got it approved by the FDA. So I started the training probably 5-6 years ago. And then when I joined Pearl Care Dental, I was so excited because Dr. Tino wanted me to be able to help bring this into her practice so we could help her patients now instead of my old patients in Seattle.
Oh, that's cool. So,
Forward-thinking, powerful, open-minded women. I love it. Sorry to cut you off, Stephanie. There's a question after you tell me what you're going to say, or tell them.
no, go ahead. Go ahead. Ask the
So
question.
Crystal Divine Whitaker is on, and she's getting ready to open up Divine, which is going to be Divine. Massage, therapy, reflexology, yoga, meditation, you name it. She wants to know if this is something kids can use.
Yes,
Yeah,
absolutely.
Yeah. So I started on this about 2 years ago, and I read a book. It's called Gasp. And it talks about airway with kids and how a lot of times we'll see allergies, asthma, crowding of the teeth, and all of that is related to just all these different factors, but mostly, you know, the tongue and the airway and our kids, how they're breathing.
And behavioral issues.
Yeah. And so I've been working for 2 years on getting ear, nose, and throat doctors that are airway focused, getting physicians that are airway focused, and cranial sacral body workers, you know, lactation consultants, just really just kind of working on building our team. So that's what I've been working on for the last 2 years. And then Carrie's just kind of that, you know, cherry on the top. So with this appliance, the amazing thing with it, like I already told Carrie, like, let's get my kids going. Austin's almost a year. He's good. Let's do it. Is that it will correct a lot of those airway, breathing, tongue issues early, so we can hopefully avoid orthodontics potentially and sleep apnea issues down the road, and then all the health consequences of that afterwards. So the kids, I think, are the cool part of it, because we can change them so much.
So I have a question.
We can.
I snore.
Yeah.
Really loud, and like that's one of the things that, like, how am I ever going to find a mate because I sound like a train?
Snoring is on the spectrum. Snoring is one of the things on the spectrum. So it's usually what people are most aware of.
Mm-hmm.
And then as we dive deeper into the diagnosis, we understand that snoring is often because there's an airway issue. And so if we can regrow the body to its own genetic potential, most Americans are underdeveloped in their mid-face. So if we can regrow the body to its own genetic potential, and we're not using force, it's not like an orthodontic appliance, we are stimulating the body's own stem cells to regrow to the body's maximum potential. It's amazing. It's almost like
yes, mind blown
science.
emoji, mind blown emoji.
It is.
Uh-huh.
So we have another question. Obviously, what you're saying is like, whoa. Someone says, how do we schedule? Actually, Crystal says, how do we schedule an appointment? Like, sign me up.
Call the office.
Call
to Tammy.
All right, Crystal Divine Whitaker, call the office. And that was another question that I saw on social media. Our dentist office is open.
Yeah, good question. So we have been open for emergencies and anyone that, you know, has a concern. We are seeing patients on the 19th. There was a proclamation by Governor Inslee that dental offices were going to be allowed to be open after the 18th. So we're scheduled on the 19th. We have 2 days booked right now, and we're kind of waiting to see. But we're hoping just kind of dentistry as usual. Dentistry closed to help conserve gloves, masks, etc. So we're hoping, but we have days scheduled, and we're in the office next week. So we're there.
So dentist's office are usually really clean, obviously,
Yes.
and protected. Are there extra layers that you guys have to do, even more than what you were doing? What does that look like?
I'm glad you asked that. So yeah, dental offices have always been what our term is universal precautions. I mean, we sanitize every single room, everything that's touchable. There's a cover on it, or we wipe it. We have gloves and masks. So, because we're Pearl Care, we've stepped it up several notches. So the one thing we have at the office that we have had since, I think, Dr. Mike, since 2008 is ozone. And Crystal, you're probably like, yeah, I know. We always talk about the cool ozone thing. So we utilize ozone gas, ozone water, ozone oil. Ozone, everyone thinks of the ozone layer, right?
Not that.
It's not that. It's not that. And Carrie's used it for years too, which was so awesome when she came on board. Ozone, in essence, is oxygen with 3 molecules. It doesn't like it. It's unstable, so it oxidizes. And what we know about oxidizing, right, is that it kind of is a disinfecting. It cleans. So it will pretty much kill viruses, fungus, bacteria. It kills everything. It doesn't get resistant because it literally breaks up the molecule. So we run that in our water lines. Our patients are actually rinsing and gargling with the ozone water when they come in to help kind of kill all the bacteria and viruses potentially. We also have what's called surgically clean air units coming. We're really excited about them. So these units will be in each room, and they are going to pretty much turn over the air, clean it, less than 5 minutes, and it kills viruses as well. So anything that goes into the air is going to pretty much disinfect it on top of the ozone. There's other little safety precautions that we're doing, but definitely I think those are our 2 big things that are going to really help keep us safe, because that's the biggest thing, is how can we keep ourselves safe so we can provide care, and then how can we keep everyone else.
So can we just come hang out in the lobby?
Right?
I want to
Yeah.
hang out in the air. Yeah.
Yeah, I know.
That's awesome. So there's another question coming. So Teddy Charlton, and we've got a whole slew of people on here this morning. 15 are registering. Like Stephanie, we beat our record. So Teddy Charlton says, amazing, good morning. And she missed what this is called. So what is this? What's the name of this apparatus, this thing? No, this, yeah, help me out here.
Well, it's more than just the apparatus. So the name of the appliance is the DNA appliance, and that refers to daytime, nighttime wear of the appliance, but it's more a system. It's a holistic system that incorporates medical, chiropractic, top to bottom to maximize your whole body health. So we're kind of like the quarterbacks to help steer people in the direction that they need to go. So we diagnose and we help people get to where they need to go to maximize their whole body's health.
So it's called the Vivo.
So the Vivo system is what the whole overall holistic health system is about. And the appliance is called the DNA appliance. Or in the case of people with sleep apnea, it also has another name, the mRNA appliance, which is a mandibular advancement appliance for really helping those snorers that need immediate help before their body grows into their new shape.
So I don't know about you, Stephanie, but there's like this whole new glow now, because when you take beautiful women with brains like these, oh my gosh, I'm loving it. And we have an engineer on here. One of my friends, Garrick, says ozone is 3 oxygens bonded in a ring. It's a very interesting structure. So you are speaking his language. He is loving this whole, you know, and I love the play on DNA, right? Because that's something I talk about in cooking a lot, is that when you reprogram anything, you are really shifting that DNA. It's, oh, this is so cool. Is it covered by insurance is another question.
Good question.
Some insurances, yes. So some medical, some dental. So we will work with the patient to find out, you know, what insurance they have and see where we can get coverage, wherever that is.
Amazing. So I know that if I were to get I'm going to call it old-fashioned sleep apnea, big old Star Trek looking thing, I would have to go to a sleep clinic. And so what's that process? Do I still do a sleep clinic? All of that? Like, do I just say, hey, I stop breathing when I'm sleeping?
Well, let us help you work with that. So historically, people that have CPAP or that have severe sleep apnea need CPAP according to the sleep physicians. So if you have severe sleep apnea, you might still need to use the CPAP until we can change the body enough to no longer need that. And that's actually diagnosed by a sleep physician. So we work with the sleep physicians to make sure that we're giving you the treatment that you need for the moment and then treatment for the long term.
So here's what I hear. You got us. Like, we get to schedule an appointment and you have literally thought about everything that comes to mind. I'm not kidding when I say, put me on the books. I will call after make an appointment.
Well, I have a question.
One of the things,
did you purposely
go ahead.
try to hire all women, or was that just kind of how it
It kind of how it fell into
happened
place.
organically?
And growing up here, I remember that there was never a female dentist growing up here. And when I started dental school, our dean was a female. And she told me the story of how she was the only dental student in her all-male class at the time, and how much ridicule she got, and men saying, you know, like, you took my friend's spot. This is a female profession. You don't deserve to be here. And when I started dental school, we were actually more females than males. And so I think just, you know, through time, it's been slowly kind of changing. And so being back home, having this office and now having 3 female dentists being in the office it's just amazing. It is so cool, the transition. So no, it's just kind of how the cards played.
Kind of how I love it.
So Matt is our lone male in the office, and Matt,
He's the only guy.
he's the only guy, and he does so well with it, and he is like Mr. Fix-It. He just fixes everything and just makes that office run so
That's
smooth.
awesome.
So yes, so we all love him dearly.
But I love that it's a husband and wife team too. And I remember thinking when I came and did the dream boarding with the staff,
Yes.
I was like, this is all women. And then in comes Matt, and I'm a real watcher. So I'm like, let's see how this goes. And it, like, you can just see that everybody is just this really gelled group. It was so much fun.
Yes, we have a very awesome culture is how I look at it.
Well,
What's
and
your
that-
culture motto, if you will? You have one?
You know, I don't know if it necessarily pertains to the culture, but I mean, I think it is a part of it. One thing is we definitely have team agreements, and those are things that we've all agreed to kind of show up and be present every single day at the office. We live by CANI, and that stands for constant and never-ending improvement. And I think in us working these last 3 weeks and COVID and learning, it's exemplified by that. I mean, we could have just sat at home and ate bonbons and closed the clinic and didn't do anything, but we decided, what can we do more? What is it that we can do more to help our patients? Because we see this every single day, multiple times a day. So I think CANI is huge, and we go by PTS, which is patient, team, self. And so our patients are always first, then the team, and then self. And so
You have a couple little mottos going.
little mottos.
Yeah, I love those. Those are great.
Yeah.
And you feel that the moment somebody picks up the phone when you call, what do they say?
What do they say? I've been answering the phone lately too, so it's I feel like a front office person now. Hi, welcome to Pearl Care. How can I help you?
I love that. And I've heard you even take that one step further and say, I can help you.
I can help you.
I can help you. And I'm like,
Oh,
oh,
That's
question.
good. I can help you.
yeah. So you're immediately not like in this you know, defensive mode, you're like, oh, well, okay, yeah, you can help me. Thank you. That's powerful. That's powerful. Words are powerful.
Yes. Yes.
So what is one, there's probably been several, but what is one aha moment about COVID? And maybe it relates to dentistry, maybe it relates to you. What would that be?
I think for me, COVID's been an interesting pause that, you know, you get sometimes stuck in the wheel and I got to do this and I got to do this and I got to do this. And it's been that nice pause that everything else can go away. And at the end of the day, it's just about the moments and living your life and what's important. And so, you know, through all of this, it has been stressful as a business owner. It's been stressful as a mom with dealing with school. And I think, though, it was that nice pause to just realize that at the end of the day, it is what it is. You know, there's certain things you just don't have control of. And you just have to do your best and just live your life. And so my balance was just having those moments with our family and trying to balance all of it. And so to me, it was an interesting pause. It was a good pause.
Mm-hmm. Yeah, as a recovering control freak, I can identify with, you know, the universal permission.
Yeah.
Yeah. What were you going to say, Carrie?
I think it's an interesting way to actually realize that we need each other and we want each other.
Yeah.
So we're all anxious to get back to being able to be with our friends and loved ones.
Yeah, profound.
We'll appreciate them more.
Those virtual hugs just aren't the same.
No,
they're not.
No.
No.
And you know, I do the little heart emoji with parentheses around it, and it's like, yeah, you know. And I used to do this. I used to do this thing with my kids where I would hold on to them for 20 seconds because biologically, that's when you start to exchange the energies. So that's really powerful. Mm-hmm. So I know that we are slated from 8:30 to 9, and I want to be mindful of everybody's time. I know Pearl Care is probably rolling right into some amazing procedure, process, mind-blowing thing this morning. And so, Iris, what would be your golden nugget from COVID?
My golden nugget, I would say, would have to be being new to the area. That the Pearl Care family has become my family here, and not having the opportunity to see them every day has been something that I might have started to take for granted since I've been here for 6 months, or no, it's been more than 6 months. And so I'm really looking forward to getting back into the swing of things and doing dentistry. I've realized that, you know, it really is a passion because I've had that month and a half break from doing it that I can't wait to get back in it and continue learning from these two amazing women and just moving forward with my career.
Love it. Love it. Want to bring us home, Stephanie?
Oh, let's see. I just, no, you do it.
The pressure's on. What strikes me is the power of collaboration and connection in a time where we can't necessarily physically connect, and how there are two sides to COVID. And this is not to diminish anybody who's struggling. However, each one of us on this screen have made a conscious decision to use this time to up level. And it's in that conscious decision, I believe, that we pull ourselves out of the very real isolation and struggle feelings inside. So I commend you for being the example and giving everybody else permission to go out and crush this, right?
Amen.
Yes, what a
Absolutely.
powerful conversation. Thank
Love
you so much, ladies. And everybody have a fabulous Friday.
Thank you.
Yes, thanks for
Thank
being on,
you.
ladies.
Bye-bye.
Bye.
Bye.
Bye.